central nervous system consists of the brain, the spinal cord, and the nerves. The brain is made up of the cerebrum, the cerebellum, the brainstem, and the limbic system. The cerebrum has two hemispheres. The lobes and structures are found in both halves of the cerebrum except the pineal gland. The corpus callosum is a pathway that connects the two hemispheres and coordinates their functions. The left hemisphere controls the right side of the body, while the right hemisphere controls the left. There are four lobes: the frontal, parietal, temporal, and occipital. Abnormalities in the frontal lobe have been associated with schizophrenia, ADHD, and dementia. The cerebellum is below the cerebrum. It's a center for the coordination of movement and postural adjustments, and receives and integrates information from all over the body. The brainstem includes the midbrain, pons, and medulla oblongata. The medulla is at the top of the spinal cord with the pons above it. The midbrain connects the pons and the cerebellum and includes most of the reticular activating system and the extrapyramidal system, which relays information about movement and coordination from the brain to the spinal nerves. In the brainstem is also the locus coeruleus, which is a group of neurons that produce norepinephrine and are associated with stress, anxiety, and impulsive behavior. The limbic system is a part of the brain that's located above the brainstem. It includes the thalamus, hypothalamus, hippocampus, and amygdala. Disturbances in the limbic system can show up in the memory loss that comes with dementia, as well as the poorly controlled emotions and impulses in psychotic and manic behavior. Neurotransmission is a process in the brain where the neurons send electrochemical messages to one another. The messages pass through the dendrites to the cell body, down the axon, across the synapses, and to the dendrites of the next neuron. The transmissions can either stimulate an action or stop an action. They're excitatory or inhibitory. The neurotransmitters fit into specific receptor cells, much like a key fits into a lock. After the neurotransmitters are released into the synapse and have relayed their message, they are either transported back to the axon to be stored for later use, which is reuptake, or are metabolized and inactivated by enzymes. The neurotransmitters have to be in the right proportions to relay their message. Neurotransmitters have been shown to play a role in psychiatric illnesses and in the side effects of psychotropic medications. As mentioned, neurotransmitters are either excitatory or inhibitory. Dopamine is excitatory. It's located mainly in the brainstem and has been found to be involved in the control of complex movement, motivation, cognition, and the regulation of emotional responses. It's synthesized from tyrosine, a dietary amino acid. It's implicated in schizophrenia, psychoses, and movement disorders like Parkinson's. Antipsychotic medications work by blocking dopamine receptors and reducing dopamine activity. Norepinephrine is also excitatory and is the most prevalent neurotransmitter. It's located mainly in the brain and has a role in changes in attention, learning, memory, sleep, wakefulness, and mood regulation. Epinephrine is a derivative of norepinephrine. They are also known as noradrenaline and adrenaline. Too much norepinephrine has been implicated in anxiety disorders, and too little may contribute to memory loss, social withdrawal, and depression. Some antidepressants block the reuptake of norepinephrine, while others inhibit it from being metabolized. Epinephrine has limited distribution in the brain, but controls the fight-or-flight response in the peripheral nervous system. Glutamate is an excitatory amino acid. At high levels, it can have a neurotoxic effect. It's been implicated in the brain damage caused by stroke, hypoglycemia, sustained hypoxia, and some degenerative diseases like Huntington's or Alzheimer's. Serotonin is inhibitory. It's only found in the brain and is derived from tryptophan, a dietary amino acid. It's involved in the control of food intake, sleep and wakefulness, temperature regulation, pain control, sexual behavior, and the regulation of emotions. It has an important role in anxiety, mood disorders, and schizophrenia. It contributes to delusions, hallucinations, and with the withdrawn behavior seen in schizophrenia. Some antidepressants block serotonin reuptake, which leaves it available in the synapse longer, which helps to improve mood. GABA is an amino acid. It's the major inhibitory neurotransmitter in the brain. It modulates other neurotransmitter systems rather than having its own direct stimulus. Drugs like benzodiazepines that increase GABA function are used to treat anxiety and to induce sleep. Histamine is a neuromodulator. It's involved in peripheral allergic responses, control of gastric secretions, cardiac stimulation, and alertness. Some drugs block histamine, which results in weight gain, sedation, and hypotension. Several mental illness may be linked to a specific gene or a combination of genes, but they are not solely genetic. Non-genetic factors also have a role. 3 types of studies are commonly done to investigate the genetic basis of mental illness. Twin studies are used to compare the rate of certain mental illnesses in identical twins with identical genetic makeup with fraternal twins who have different genetic makeup. Adoption studies are used to determine a trait among biologic versus adoptive family members. Family studies are used to look at whether a trait is more common among first-degree relatives like parents, siblings, and children than among more distant relatives or the general population. Psychoimmunology is a fairly new field of study. It looks at the effects of psychosocial stressors on the body's immune system. A compromised immune system could contribute to the development of a variety of illnesses, particularly in populations at risk. So far, it has been unsuccessful. However, the brain and immune system can influence neurotransmitters, so when the inflammatory response is involved in an illness like MS or lupus, mood dysregulation and depression can be common. Most of the studies looking at infection as a cause of mental illness are focusing on schizophrenia, but none have provided any conclusive evidence. Theories are looking at a virus that may alter human genes and maternal exposure to a virus during the fetal development of the nervous system, which may impact the developing brain and contribute to schizophrenia. So what is the nurse's role in this? The nurse helps to ensure that patients and families are kept informed about the progress in these areas and to help them distinguish between facts and hypotheses. The nurse can explain if or how new research may affect a person's treatment or prognosis. The nurse is a resource for providing information and answering questions. There was a time when the brain could only be seen through surgery or autopsy. In recent years, new techniques have been developed to see the brain structure and function and are helpful in diagnosing some disorders. CT. This uses a precise X-ray beam and takes cross-sectional images layer by layer. The computer reconstructs the images and stores them on magnetic tape or film. It can visualize soft tissues so it can be used to diagnose primary tumors, metastases, and determine the size of the ventricles in the brain. Some people with schizophrenia have been shown to have enlarged ventricles. The patient has to lie still on a table for 20 to 40 minutes while they go through a tunnel-like ring where the serial X-rays are taken. MRI. This is a body scan where the energy field is created with a huge magnet and radio waves. The energy field is converted to a scan. The MRI gives more tissue detail and contrast than a CT, and it can show blood flow and tissue changes like edema. It can also measure the size and thickness of brain structures. People with schizophrenia can have up to a 7% reduction in cortical thickness. The patient lies in a small closed chamber and has to be motionless for 45 minutes. PET scan and SPECT. These look at the function of the brain. Radioactive substances are injected into the bloodstream, which are then monitored while the patient performs cognitive activities as instructed by the person performing the scan. PET scan uses 2 photons at the same time while SPECT uses 1. A PET scan has a better resolution and a clearer image and takes 2 to 3 hours, while SPECT takes 1 to 2 hours. Both are used mainly for research. Limitations. Because they use radioactive substances, PET scans and SPECT can only be used so many times. You also have to watch for allergic reactions to the substances. Some people are scared to have the injections. Some people might be scared of the procedure or they might be claustrophobic. Many of the changes in the brain are at the molecular level and can't be seen with the current imaging techniques. There are several different types of psychotropic drugs that are used to treat mental disorders: antipsychotics, antidepressants, mood stabilizers, anxiolytics, and stimulants. The efficacy of a drug refers to the maximal therapeutic effect the drug can have. Potency is the amount of drug needed to get the maximum effect. A low-potency drug may require a high dosage to get the same desired efficacy, whereas a high-potency drug may need a low one. Half-life is the time it takes for half the drug to be removed from the bloodstream. If a med has a short half-life, the patient may need more frequent doses than a medication with a longer half-life. The FDA approves drugs for use in a particular population and for specific diseases. Off-label use occurs when a drug is found to be effective for a disease other than what it was approved for. Gabapentin or Neurontin is an antiepileptic that is used frequently in mental health for anxiety and pain. A black box warning means that the medication has been found to have serious or life-threatening side effects. There are many psychotropic medications that have black box warnings. The principles of psychopharmacology guide the use of the medications given to treat psychiatric disorders. Meds are chosen based on their effects on the patient's symptoms, like delusions, anxiety, and so forth. Its effectiveness is determined by whether or not the symptoms subside. Many drugs require time to build up in the patient's system to achieve their full effect, so the patient must get an adequate dose for a long enough time. Many antidepressants can take 4 to 6 weeks to get their full effect. Give the lowest effective dose to the patient. Sometimes the patient needs a higher initial dose or a loading dose that can be lowered over time. Older adults usually need lower doses to achieve the same effects as younger people on higher doses, and it can take older adults a longer time to get to therapeutic levels. Dose carefully. Medications frequently need to be tapered rather than stopped suddenly, like benzodiazepines. Not tapering can cause rebound or withdrawal. Follow-up care is needed to make sure the patient is following their medication regimen and to make adjustments in medications as needed. Keep the medication regimen as simple as possible to help with compliance. This includes both the number of meds ordered as well as how often they are ordered. Antipsychotics used to be known as neuroleptics, and they treat the symptoms of psychosis, like hallucinations or delusions. First-generation antipsychotics include chlorpromazine, fluphenazine, and haloperidol. Second-generation antipsychotics include clozapine, risperidone, olanzapine, ziprasidone, and paliperidone. Third-generation antipsychotics include aripiprazole, cariprazine, and brexpiprazole. Antipsychotics work by blocking the dopamine receptors in the brain. They've been in use since the 1950s. Second-generation medications also inhibit the reuptake of serotonin, which helps with the depressive aspects of schizophrenia. Third-generation antipsychotics are being developed. They're thought to stabilize the dopamine output, increase it when it's too low, and decrease it when it's too high. Prolixin and Haldol were the first long-acting injectables. Long-acting injectables help to increase med compliance because the injection is typically needed only every 4 weeks. Zyprexa Roprev is one of the most likely to cause post-injection delirium or sedation syndrome, which is sedation, confusion, disorientation, agitation, and cognitive impairment that can progress to ataxia, convulsions, weakness, and hypertension that can lead to arrest. So these patients must be monitored for 3 hours after each injection. Invega Trinza is new and it's good for 3 months instead of 1. Extrapyramidal syndrome, or EPS, is the major side effect of antipsychotics. EPS includes acute dystonia, pseudoparkinsonism, and akathisia. First-generation antipsychotics are the most likely to cause EPS. Acute dystonia is most likely to occur in the first week of treatment and includes symptoms of muscular rigidity, cramping, and a thick tongue with difficulty swallowing. It's painful and scary for the patient, but it can be treated with iambenztropine or diphenhydramine. It's more likely to occur in patients who are male, under 40 years old, or are getting high-potency medications like haloperidol. Pseudoparkinsonism symptoms are similar to Parkinson's. stooped posture, mask-like face, shuffling gait, cogwheeling, hill rolling, drooling, and bradycardia. It's also treated with benztropine or by switching medications to one with a lower incidence of EPS. Akathisia symptoms include restlessness, anxiety, rigid posture or gait, and the patient reporting a feeling of internal restlessness and a need to move about. It's also treated with benztropine or by changing medications to one with a lower incidence of EPS. Neuroleptic malignant syndrome, or NMS, is a potentially fatal reaction to an antipsychotic. Symptoms include rigidity, high fever, unstable blood pressure, diaphoresis, pallor, and delirium. It usually occurs in the first 2 weeks of use or after a dosage increase and is most common with high doses or high potency medications. Dehydration, poor nutrition, and concurrent medical illnesses will all increase the likelihood of NMS. Treatment includes discontinuing all antipsychotics and medical care to stabilize the patient. Tardive dyskinesia is a syndrome of permanent involuntary movements and is most commonly caused by the long-term use of conventional or first-generation antipsychotics. Symptoms include involuntary movements of the tongue, facial and neck muscles, and in the extremities. You're most likely to see tongue thrusting, lip smacking, blinking, grimacing, or other excessive facial movements. Once it develops, it is permanent, although decreasing or discontinuing the antipsychotic can stop the progression. Prevention of tardive dyskinesia is done through keeping maintenance dosages as low as possible, changing medications, and monitoring the patient for signs of tardive dyskinesia. Anticholinergic side effects can also occur with antipsychotics. Symptoms include dry mouth, constipation, urinary retention, blurred vision, dry eyes, nasal congestion, and photophobia. You may need to encourage your patient to take frequent drinks, use sugar-free hard candy, and ask for stool softeners to help your patient if they experience these symptoms. Other side effects patients may experience include increased prolactin levels, which can cause breast enlargement and tenderness in both men and women, along with decreased libido and other sexual side effects. Patients may experience weight gain, particularly with the second-generation antipsychotics, with the exception of ziprasidone. Weight gain is most likely to happen with olanzapine or Clozaril. Antipsychotics can increase blood sugar and put the patient at an increased risk of diabetes, and can also increase the QT interval, so the patient may need EKGs prior to the beginning of antipsychotics and during therapy. Clozapine can cause agranulocytosis, which can be fatal. Agranulocytosis is a failure of the bone marrow to produce enough white blood cells, so the patient will need to have their WBCs monitored regularly throughout therapy. Symptoms of agranulocytosis include fever, malaise, leukopenia, and ulcerative sore throat. Medication compliance can be a big problem with antipsychotics, so the patient needs to be taught to report side effects to their doctor rather than discontinuing the medication. Patients can be taught ways to manage side effects, such as using sugar-free hard candy, exercising, and increasing their water intake. Patients need to monitor their drowsiness and avoid driving or other dangerous activities until their response time and reflexes are back to normal. If a patient forgets a dose of medication, they can take it up to 4 hours late, otherwise they should wait for the next dose. If a patient has trouble remembering their medication, teach them ways to help remember, such as using a chart or pre-filled pill boxes. Antidepressants are used to treat major depression, anxiety, the depressed phase of bipolar, and psychotic depression. Some off-label uses include treating pain, migraines, neuropathy, eating disorders, panic disorder, and sleep apnea. There are 4 groups of antidepressants: tricyclics, SSRIs, MAOIs, and others. Antidepressants interact with norepinephrine and serotonin to regulate mood, attention, appetite, arousal, and sensory processing. SSRIs block the reuptake of serotonin. Cyclics block the reuptake of norepinephrine primarily with some serotonin, and MAOIs interfere with enzyme metabolism. Antidepressants typically need several weeks to be effective. Cyclics can take 4 to 6 weeks for full effectiveness, MAOIs 2 to 4 weeks, and SSRIs 2 to 3 weeks. SSRIs are popular choices of antidepressants because they have fewer side effects than other medications, and they are not lethal if a patient attempts suicide and overdoses. Side effects for SSRIs include anxiety, akathisia, agitation, nausea, insomnia, sexual dysfunction, and weight gain, although the weight gain with SSRIs is less than with other antidepressants. Akathisia might be treated with a beta blocker like propranolol. Taking the medication with food can reduce nausea, and trazodone can help with insomnia. Tricyclics can have anticholinergic effects like dry mouth, constipation, urinary retention, and blurred vision. Older adults may experience more severe symptoms like agitation, delirium, and ileus. Other side effects include orthostatic hypotension, sedation, weight gain, tachycardia, and sexual dysfunction. MAOI side effects include daytime sedation, insomnia, weight gain, dry mouth, orthostatic hypotension, and sexual dysfunction. Patients can also have a potentially fatal hypertensive crisis if they ingest foods that contain tyramine. Foods like aged cheeses and meats, fava beans, tofu, beers, sauerkraut, soy sauce, yogurt, sour cream, and more. Symptoms of a hypertensive crisis include hypertension, tachycardia, diaphoresis, and cardiac dysrhythmias. Other antidepressants include bupropion, venlafaxine, trazodone, and duloxetine. Side effects depend on the medication, but can include dry mouth, headaches, loss of appetite, dizziness, and sweating. Serotonin syndrome is a serious interaction that can occur when a patient takes an MAOI and SSRI at the same time or too close together. One medication must be completely out of the patient's system before the other is started, so you might see a couple of weeks pass before a new medication is started. Symptoms of serotonin syndrome can include agitation, sweating, fever, tachycardia, hypotension, rigidity, hyperreflexia, and even coma or death. Some patient teaching for patients taking an antidepressant include taking SSRIs first thing in the morning and taking TCAs or tricyclics at night. If a patient misses a dose of an SSRI, they can take it up to 8 hours afterward, but a TCA should be taken within 3 hours. Patients need to be cautious when driving or doing other activities that require sharp reflexes until the sedative effects are known. Patients taking MAOIs need to be taught about the dietary restrictions and possible drug interactions, so they should not take new medications, including over-the-counter meds, unless they check with their doctor first. Mood stabilizers are used to treat bipolar disorder by stabilizing the patient's mood and minimizing the highs and lows the patient experiences with bipolar. Medications include lithium, carbamazepine, valproic acid, oxcarbazepine, topiramate, and lamotrigine. The mechanism of action depends on the medication. Lithium normalizes the reuptake of serotonin, norepinephrine, acetylcholine, and dopamine, and reduces the release of norepinephrine. Lithium is the first-line treatment for bipolar disorder. Anticonvulsants are used to treat bipolar as off-label use, and the mechanism of action is not known as mood stabilizers. We do know that valproic acid and topiramate increase GABA, and valproic acid and carbamazepine inhibit the kindling process. Lithium is available in multiple forms, and its dosage has a wide range because we want to get the lithium levels to therapeutic range. Therapeutic range is 0.6 to 1.2 milliequivalents per liter. This is a very narrow range and requires frequent monitoring with serum lithium levels. Lithium levels over 1.5 are considered toxic. Side effects of lithium therapy include nausea, anorexia, fine hand tremors, polydipsia, polyuria, a metallic taste in the mouth, fatigue, weight gain, and acne. Early signs of lithium toxicity include severe diarrhea, vomiting, drowsiness, muscle weakness, and a lack of coordination. If the symptoms continue to get worse, you can see renal failure, coma, and death. You also need to keep in mind that lithium is a salt and acts on sodium receptors, so if the patient increases their salt intake, they may become symptomatic. Side effects of carbamazepine and valproic acid include drowsiness, sedation, dry mouth, and blurred vision. Carbamazepine may cause rashes or orthostatic hypotension. Valproic acid or Depakote may cause weight gain, alopecia, and hand tremor. Valproic acid also requires lab monitoring. It needs serum levels drawn to make sure levels are in therapeutic range, which is 50 to 100. It may cause hepatic failure, requiring liver function tests before starting therapy and at frequent intervals after therapy is started. Topiramate may cause dizziness, sedation, and weight loss. Patient teaching needs to include the need for monitoring blood levels, particularly with lithium and valproic acid. Time of the last dose is needed, as labs should be drawn 12 hours after the last dose. Taking medications with meals can help with nausea. Patients should not drive until dizziness, fatigue, and blurred vision have subsided. Anti-anxiety medications, or anxiolytics, are used to treat anxiety, insomnia, OCD, depression, PTSD, and alcohol withdrawal. Benzodiazepines are the most effective in treating anxiety and are the most frequently prescribed. Benzos work by mediating the action of GABA. Some common benzos that you might see are alprazolam, clonazepam, diazepam, lorazepam, and temazepam. Buspirone and hydroxyzine are non-benzodiazepines that are used to treat anxiety. Buspirone works by acting as a partial agonist at serotonin receptors and is the drug of choice for patients with a history of substance abuse. Benzos have a high risk of causing both physical and psychological dependence. The patient can experience withdrawal symptoms if the medication is stopped suddenly, so it needs to be tapered. Patients can also worry about anxiety symptoms returning if they stop taking the benzos and may believe that they aren't able to handle their anxiety without the use of medication. Side effects of benzos include drowsiness, sedation, poor coordination, and impaired memory. Side effects of buspirone include dizziness, sedation, nausea, and headaches. Patients need to understand that medications can relieve anxiety symptoms, but they do not treat the underlying problems. Benzos strongly potentiate the effects of alcohol, so the patient needs to avoid alcohol while taking benzos. Patients will also have decreased response time and slower reflexes, so they should be careful attempting to drive or returning to work. Do not stop taking benzos suddenly. Withdrawal can be fatal. Stimulants are used to treat ADHD in both children and adolescents, residual ADD in adults, and narcolepsy. Methylphenidate and amphetamine are the main medications used. The potential for abuse with amphetamines is high, and long-term use can lead to drug dependence. Methylphenidate and amphetamines cause the release of norepinephrine, dopamine, and serotonin from presynaptic nerve terminals and block their reuptake. Side effects of stimulants include anorexia, weight loss, nausea, and irritability. Stimulants can cause growth and weight suppression in kids, but drug holidays, which is not taking the medication on days when it's not needed, like weekends and summer holidays, help to prevent this. Teach the patient that caffeine, sugar, and chocolate can make the side effects worse, so they need to be avoided. Taking medication after meals can help to minimize anorexia and nausea. Be sure to keep the medication out of reach of children, as overdose can be fatal. Disulfiram is a deterrent to drinking alcohol, but it does not block cravings. It can be useful for people who are motivated not to drink and are not impulsive. It causes an adverse reaction when mixed with alcohol in the body. About 5 to 10 minutes after alcohol is ingested, the person will begin to experience facial and body flushing, a throbbing headache, sweating, dry mouth, nausea, vomiting, dizziness, and weakness. Severe cases can include chest pain, dyspnea, hypotension, confusion, and death. Disulfiram can interfere with the metabolism of other drugs, so check with your doctor before taking it. Patients who take disulfiram need to check labels carefully for alcohol content before using common products like shaving cream, aftershave, deodorant, and cough remedies. Products must be alcohol-free or the person may have the same symptoms as if they drank. People from different backgrounds respond differently to psychiatric medications. African Americans may respond more rapidly to antipsychotics and tricyclics than whites, and have a greater chance of having side effects. Asians metabolize antipsychotics and tricyclics more slowly than whites, so they need a lower dose to achieve the same effects. Hispanics can use a lower dose of antidepressants to achieve the same effects as whites. Asians and African Americans can have a lower dose of lithium and still get the same effect as whites. Many cultures have used herbs for hundreds of years, and it's becoming more popular in the United States as well. So be sure to ask about them when questioning patients about medications. They don't always consider them medications and may not tell you if they're taking them if you don't ask about them specifically. St. John's wort is used for depression. Kava is used for anxiety and can potentiate the effects of alcohol, benzos, and other sedative hypnotics. Valerian helps with sleep, and it's occasionally used for stress and anxiety. Ginkgo biloba helps to improve memory, fatigue, anxiety, and depression. Herbs are not regulated like medications and are not standardized. Combining herbs with some meds can cause interactions, so be sure to ask your patients if they are using any herbs. There are a lot of barriers for patients when taking medications. Frequently, they start to feel better, so they stop taking their meds, thinking that they are better and don't need the meds anymore. They need to understand that the medication helps to control the symptoms. It does not cure the disease, so they need to continue taking their meds even when they feel better. Mentally ill people may not have the best insight into their condition. Either they stop taking the meds because they don't like the side effects like weight gain or gynecomastia. Those are two side effects that can be prohibitive for some people. And some people like how they feel when they are manic and stop taking their meds so they can feel that way again. There's also still a stigma against mental illness, and some don't want to admit that they have a problem. If they don't have a problem, then they don't need that medication. Chronic mental illness has times of remission and exacerbation just like a physical illness does. A recurrence of symptoms is not the patient's fault or a failure of treatment. Don't dismiss new ideas. Research of mental disorders is still new, and there may be breakthroughs in the future. Medication noncompliance may be a part of the illness. It's not always willful action on the part of the patient.